All right, let's finish off this section by talking about other causes of set point elevation and weight gain. The three that we're going to discuss in this video are a lack of sleep, chronic disease, and hormones in beef. So let's start with a lack of sleep. If there's one type of patient that I get the most frustrated by in my office, and I'm the most pessimistic about their ability to lose weight through nutritional means, it's the patient who works the night shift. There is something about working at night and sleeping during the day that disrupts your sleep-wake cycle in a way that makes it incredibly difficult to lose weight. Now, a lot of people think that on the night shift there's always a lot of junk food around, and that's the reason that there's weight gain. There's also thoughts that it's the irregular eating pattern. If you work the night shift, what time is breakfast? When's lunch? When's dinner? Do you eat 3 meals at night and then also 3 meals during the day with everyone else? How does that work for you? It's really confusing, and when I talk to patients who work the night shift, I find a lot of variability. Some people schedule their meals one way, others schedule their meals completely different way. But really, I think the underlying cause is that this disruption in the normal sleep-wake cycle causes a elevation in certain hormones like cortisol, like we talked about in the last video on stress and depression, that will cause and trigger weight gain. So we're really unclear of exactly why this is happening, but we know that poor sleep patterns are absolutely linked to weight gain. And this is another one of these dangerous positive feedback loops. Again, not a negative feedback loop like the way your metabolic thermostat works or the way most things in our body work, but when we get into this positive feedback loop where a lack of sleep causes weight gain, which can cause more lack of sleep, this is dangerous. And where we see this the most clearly is in sleep apnea. Sleep apnea is a disease where as you fall asleep, your airway closes and you lose your ability to breathe. The most common symptom of this is snoring, but it's more than just snoring. It's if you watch someone sleeping who has sleep apnea, they'll actually stop breathing for a period of time. They'll essentially start to suffocate a little bit. The carbon dioxide levels in their bloodstream will rise enough to wake them up just enough to open up their airway to breathe deeply and to start breathing normally again, where they'll then go back and ultimately drift back into that deep level of sleep, which shuts off their airway again and causes them to wake up. So the problem is you just never get into a deep sleep, because every time you do, all the tissue in the back of your throat will close off your airway so you're unable to breathe. So what happens is if you have some sleep apnea, you're not getting a good night's sleep. And one of the classic symptoms of this is daytime sleepiness. So if you wake up after sleeping 8 hours, but you felt like you barely slept, that also is worrisome. If your friends or family tell you, man, you snore like crazy, that's also very worrisome. You can just look in the mirror, and if you have a relatively thick neck or a lot of tissue underneath your jaw, that also is worrisome that you may be suffering from sleep apnea. And there's tests that can be performed, and there's appliances that you can wear while you're sleeping that will help push air in and keep things open. When I talk to patients, there's a lot of mixed reviews about these. Some people cannot stand them and they can't sleep with them. Other people swear by them and say, man, and once I got that machine, I started sleeping through the night. It was fantastic. I love my CPAP machine. But essentially what happens is sleep apnea induces a lack of sleep, which causes weight gain. And more weight gain causes more tissue buildup and a worsening of the sleep apnea. And we get this positive feedback loop where less sleep causes more weight gain causes even less sleep, and so on and so on and so on. And this is a dangerous cycle. This is something that has to be broken by initially getting treated with a CPAP machine and ultimately losing the weight so that the sleep apnea resolves. And we see with significant weight loss, sleep apnea improves tremendously. I've had, at this point, hundreds and hundreds of patients who've been able to stop using their sleep apnea machine as a result of weight loss. Let's switch topics and talk a little bit about chronic disease. So there's some chronic illnesses that can result in weight gain. These are typically related to the medication that are required to treat them. So chronic fatigue syndrome or fibromyalgia is often treated with medications like Lyrica or Neurontin, both of which can cause cause weight gain. They also often are associated with pain, and pain, as we've talked about in the past, will limit your body's ability to increase your metabolism and burn off all those extra calories if your metabolic thermostat's trying to bring you back down to that set point weight. So I see a lot of patients with fibromyalgia in my office, and it is certainly associated with weight gain. Any disease that requires steroid treatment. I've seen patients who have severe lupus or rheumatoid arthritis where steroids are really one of the only medications that can help them keep their inflammation down to a reasonable level. Also with chronic asthma or bronchitis exacerbations, where patients will go months and months with difficulty breathing, and ultimately steroids are the only thing that can bring that back down, and these patients will get 3, 4, 5 steroid treatments per month sometimes, per year sometimes, that will help their breathing, but the result is it causes a lot of weight gain. Breast cancer also, because some of the breast cancer medications, the hormone suppression of breast cancer, can cause a little bit of weight gain. Not a ton, but some, and that's linked to it. We're also starting to learn that obesity causes breast cancer. So again, the obesity causes breast cancer, which then requires you to be on a medication which can cause even more weight gain, and we get into one of these positive feedback loops again. And finally, hypothyroidism. I put this on the list because it's often talked about. I think it's a small player. It's certainly not the primary cause why patients gain a lot of weight, but it is something to be aware of. I think the last thing that we're going to talk about is hormones in beef and dairy. Now, a lot of our beef, and I call it supermarket beef, and it's the stuff you can buy at your local supermarket. Almost all of that comes from a feedlot, and those animals are almost exclusively treated with hormones. And what they do is they put this little implant underneath the skin of the cows, and it releases either natural or synthetic versions of estrogen, progesterone, or testosterone. And what we know about these hormones is that they're concentrated in the animal fat. And so when we administer these hormones to the cow, they will end up concentrating some of these hormones, or the byproducts of the metabolic byproducts of these hormones, in their fat, which of course is in the meat that we're eating. The goal of giving these hormones is to make the animal grow faster on less food, so that it reduces the cost of raising this cattle. And the question I have, and one that really is a very difficult one to answer, but is certainly one that is suspect, is does this have that same effect on us? Do hormones in supermarket beef, in hormone treated cows, does that cause weight gain in all of us? And I don't know the answer. I think that there is some suspicion and concern about it. You're seeing a lot of discussion about grass-fed and hormone-free beef, and I certainly support that as the primary way if you're going to eat beef. So in summary, there's a lot of different factors that can cause set point elevation and weight gain. And if we're going to succeed, and as we're going to talk about in the next section, how we bring your set point down, how we lower your set point down. But if you're going to have any success in lowering your set point, the first thing that you must do is identify the factors that are causing your set point to go up and eliminating them. And I think, again, this really brings back the point, everything we've talked about what's caused weight gain. This is not a battle of willpower. This is not a battle of mind over matter, where if you could just convince yourself to eat less, all of the weight would fall off and all of your problems would go away. You have to be strategic and really look deeply into your medical history and all the factors in your life and your environment that are contributing to your weight gain, and do everything you can to eliminate those. And then we're going to move forward and talk about how we can get that weight off.